Hi, I'm Susan Letvak. I am an associate professor of nursing at the University of North Carolina at Greensboro, and I do research on the health and safety of the nursing workforce. In the late 1800s, a nurse supervisor at a hospital in Great Britain said, "We have to kill a few nurses to cure 1 million patients." And that attitude hasn't changed much. About 15 years ago, I started doing research on the aging of the workforce. I was very concerned about how older nurses were being treated by their coworkers, by administration, by hospitals. They were basically being let go. We deal with sick and suffering every single day, and we keep it inside of ourselves. We don't want to bring it home. And I think the strain of the grieving and the stress of the jobs is leading to more mental health problems. So we get occupational health problems by the nature of our job. Nurses tend not to bring their pain to work. We suck it up. We put a smile on our face and say, "Good morning, I'm your nurse today." And we don't show our pain. And even when we do have health problems, we don't tell anybody, especially our managers. A lot of times there's punitive action against nurses that aren't able to keep up. They're told, "Well, you can't handle the demands of a staff nurse anymore. You'll have to find another position." Lo and behold, there isn't another position, because if they don't want you on one unit, they're unlikely to want you in another area. So I'm very alarmed about the nursing workforce. The United States, less than 20% of nurses are in a union. In Canada, it's almost 80%. You have the advantage of collective bargaining to assist you in getting better ergonomic standards, more lifts, more lift teams, better working conditions in terms of hours, flexible scheduling. We now know that nurses that have health problems are directly linked to having more medication errors, patient falls, and poor quality of care. We don't know how to measure productivity losses, because if you're functioning at 80% because your back is hurting you so bad, or you're depressed and you can't think clearly, you're not able to be productive. How do you measure that productivity loss is hard to capture. We do know that if you make a medication error or if your patient falls, it costs the hospital $1,400 per nurse on average across the system. We have a punitive environment, and I don't know how it is in many Canadian hospitals, but in the United States, when a nurse gets injured on the job, the first thing they do when they show up at occupational health or in the emergency department is take a urine sample. And they're looking to see if the nurse has taken any medications they shouldn't have been. Well, lo and behold, they might have taken an anti-anxiety, anti-depression pill, or a pain pill. And the hospital saying, "Look, you're working under the influence," or "Look, you're working, this is your fault." And they could lose their jobs. So they're now afraid to report their injuries. Hospitals and administrators know nurses have pain and they may have depression, but they have chosen to ignore it because it hasn't impacted them. One of the critical groups that have to really be aware of this are nurse managers, because they are in the key position to help their nurses. And they are aware of it. They've just been afraid, I think, to get involved with the personal life of nurses. But they have to be aware and offer nurses what are the avenues if they do have health problems so they can stay healthy and to get help for their problems, especially with depression. So nurse managers, I think, really have to be accountable to looking at the health problems of their nurses and saying, take a depression screen. Are you in pain? Are you able to lift 50 pounds, which I think is maybe 30 kilograms, to stay healthy in your work environment? And nurses shouldn't be afraid to get treatment for their pain or depression, because not only is it impacting themselves and their families, probably their coworkers, but it's impacting the very people that they want to care for and provide the best care for. The best future for nurses is to have nurses more involved in decision-making. Very often, the staff nurse is the last person to be asked about pretty much anything that goes on in patient care or in hospitals. I say we need innovative new roles for nurses. Do you need a nurse with brawn and vigor, or someone with experience and intelligence to critically think to take care of complex patients in a complex health system? I've been very surprised at how nurses have responded to my research. I'm always concerned that this research will look negatively on nurses now that we know that their health may be impacting the quality of care. However, nurses are grateful that it has brought awareness to the situation. There's a tremendous value to come to speak at conferences. There's a larger audience that gets to hear the message. We provide handouts, so every nurse that attends a conference usually goes back to their facility and provides the information. So for every one person you spoke to, potentially 50 or 100 more people can hear the message. And then when you're put on video and put up on websites, the audience becomes that much larger. My favorite group to speak to are other nurses that are grateful to hear that they are not alone that they may have pain or they may be suffering from a mental health illness, and they are not alone when they see statistics that 2 out of 10 nurses may have depression. 70% of nurses are going to work every day not feeling well. So they are not alone, and sometimes just knowing that there are others that are sharing your experience makes it easier to get through the day and to help find innovative ways to make the workforce a better place to be.